Good afternoon, everyone, and welcome to another episode of Alabama Care. I am Lane Hagan, and I am talking with the Deputy Commissioner, Miss Ginger Weddingfeld, the Alabama Medicaid system. Miss Weddingfeld, would you like to introduce yourself a little bit more and tell us how long you've been with Medicaid and a little bit about your role there?
Sure. As you said, my name is Ginger Weddingfeld. I have been with the Medicaid agency for about 16 years, and I've spent a lot of time, the majority of my time, in long-term care and waivers. And then about a year ago, this time last year, I moved up to the deputy commissioner position that encompasses more than just long-term care, but some of the other EPSDT services and mental health services, but more services than just the long-term care. So it's been a learning curve for sure this past year for me.
Well, you've had a very long career there. You mentioned waivers. That is a hot topic of conversation in the special needs community, and one of the main topics that I kind of wanted to touch on in this conversation. Personally, in our family, we do not have Medicaid. When my daughter was born, the hospital staff was like, "Oh yeah, you'll have no problem applying for getting Libby Medicaid and waiver and this and that." And so we did as soon as she got home. And we were denied based on income in the house. And we asked some questions and we just didn't get a whole lot of answers. So I haven't really dealt with the waiver myself, but I did reach out to a few therapists and some friends, and they gave me a pretty good list of questions that we wanted to touch on. And I think, honestly, just the first one is, what exactly is the Medicaid waiver?
So, basic Medicaid has some eligibility requirements based on income. However, the Medicaid waiver waives some of the basic requirements for Medicaid if you meet or if you have a condition that would require you to meet the institutional level of care, whether that's nursing home or intermediate care facility. So we can exceed the regular income limit if you have these medical conditions that could qualify you for an institution.
So that does not count if we've got home care needed. It's only if they're institutionalized.
No, it's the institutional level of care. Means
Okay.
that were the situation different, the individual would qualify for institutional level of care in the institution.
So is the waiver always financial based, or is there a non-financial waiver?
There's two pieces to waiver enrollment, the financial piece and the medical piece. So there's always going to be a financial piece.
Okay. Um, so some of the conversations I've had with some of the therapists are they felt like the waiver kind of changes person to person, and they were wanted a little more clarification on who can apply, who would get approved, and who wouldn't, because they've had patients that they felt like definitely should qualify and didn't, and then they had some that they didn't think should qualify and did, and they just wanted to see they felt like there's a lot of gray area involved in the financial qualifications for the waiver.
The financial limit for waiver application is $2,523 per month, and that's based on the individual, not the family. So that's the financial limit. And then all of our medical criteria is on the website. It's equivalent to the same criteria that would allow you to enter a nursing home or an ICF facility. So all that's on the website. It's a checklist. Whether you meet these things or how many of these criteria do you meet in both situations.
Do you happen to know how long the average time it is for someone to apply for the waiver and when they get accepted?
It just depends on the individual. If they've already been determined disabled by SSI, the process is a little different. If they have not been determined disabled, that process has to occur. We have an internal process for those individuals. So it just depends which route that particular application needs to go.
Do you happen to know what the current wait list is? Because I've had some people I talked to that said they've been on the wait list for about 2 years.
We have vacancy in all of our waiver programs, except for the DMH programs. There is individuals that do wait for services on that program, but all of our other waivers have vacancies.
Okay. That's helpful. Thank you. One question I have, it says that I have been prepared for, is the difference between being on the elderly and disabled waiver as a child under 21 and having to change waivers once your child hits 21. Can you explain the difference in that and what the process looks like and having to change the waiver?
There is no difference, and you don't have to change. You're enrolled in the elderly and disabled waiver. You can be a child or an adult. The array of services is the same. It's based on your individual needs and your person-centered evaluation.
Okay.
No difference and no need to change.
So what type of waiver does 21 and up need to qualify for adult services? Is it the same E&D?
Same. All of our 7 waiver programs have an age criteria. Some start at 0, some start at 3 years of age. The independent living waiver starts at 18. The technology assisted waiver starts at 21. So it just depends what your clinical needs are, and then you choose the program that would best suit your needs.
So at what age would you recommend a transition child to reach out to places like VOC rehab and adult day programs?
Well, I reached out to the subject matter expert at the Department of Rehabilitation Services, and she says that you can start the process in 9th grade or at the age of 16, whichever's first. That's for individuals that want to transition to work out of school. And then it gets gradually more intense, 11th grade and then 12th grade. And you can access a rehab counselor through the school, through perhaps a special education teacher at the school can make that connection.
Okay. I guess one of my questions personally is, who kind of makes the decisions on specific items as to what is approved, what is not, what is medically necessary, what is not? Because from my involvement with a lot of families over the past 2 years of running a nonprofit is that a lot of items these families are needing, insurance and Medicaid, both private insurance and Medicaid, are saying that they're not medically necessary. So who's the decision maker that says that?
Well, we are bound by federal and state guidelines related to equipment or requests. So that's first. And then medical necessity can be evaluated by a nurse or a physician here at the agency. Just depends on which piece of equipment or what the request is.
Now, there are some items that I know are never approved. Is that a federal guideline, or is that something that is only in Alabama? Example, sleep safe beds. I've probably had at least a dozen or so families ask me to help assist with the cost of those. And every time they're like, well, Medicaid won't approve it or Blue Cross won't approve it. They say it's not medically necessary. Is that a federal guideline, or is that something that Alabama is doing?
I don't know about the sleep safe specifically, but we do follow a lot of Medicare guidelines, what Medicare covers, and then we can expand beyond that. But on our waiver program, we do allow equipment as a service, supplies and equipment, and sometimes those purchases can be made there. So there is an opportunity a couple different ways.
Okay. So one of the things that I've kind of wondered is in regards to some of these items that are deemed medically not necessary, but yet we have medical professionals that are telling us they are necessary and they are required. If a parent wanted to say, okay, Medicaid, you're telling me it's not required, but yet I have this professional and that professional telling me it is required, how would a parent go about kind of not fighting with Medicaid on it, but trying to get an item approved if we have medical professionals telling us it is, but you're telling us it's not? How would a parent go about maybe changing the policy or changing that item to get it approved?
We have program managers, depending on, which piece of equipment there's a question about, and somebody can contact that program manager, and start that process and see if there's an opportunity to have that approved. If there's a way to show extraordinary need, every request can be evaluated individually. So we have contact information on the website, for if you're looking for DME specifically. That process can start there.
Is there a parent panel that has any say so or any feedback given to Medicaid?
Not necessarily for general Medicaid, but some of our managed care programs have, the Citizens Advisory Council, which includes recipients and parents, along with providers in the community to help, to help advise and make good decisions.
Gotcha. That's definitely that's something I think all insurance companies could benefit from. I think just being able to have parents that are on the ground that are doing it each and every day. We see how much money it costs to raise these special needs children, and I have been doing it for the past 8 years, and our situation is very different than most, but I've communicated with so many different ones, and I think there's so much that we see and do day to day that I think we could get more assistance with. And I'm sure I'm not the first to tell you. I won't be the last to tell you. That's just personal input and personal opinion there. Let's kind of change subjects here. I personally, and a lot of people have heard, especially recently with all the political stuff that's been going on, when a politician says expand Medicaid, what does that look like?
It would expand the population that is eligible for Medicaid. So like I said, the regular Medicaid income limit is approximately $860. Expanding it would increase that income limit, so that would allow more able-bodied adults without a child in the home to be eligible, theoretically. Yes.
Is that something that would take place on a state level or a federal level?
That decision is left up to the state.
And is our current administration having any conversations about that, or are they pretty set on keeping us where we are?
I do not know. When those decisions are made at the Capitol, we will absolutely do what's required of us.
What do you know? What percentage of Alabamians are on Medicaid?
I know it's 53%. We'll find that out.
All right, Melanie with Communications is in here. She's going to find out.
Okay. Thank you. Let's see.
He didn't.
Back to waivers. I'm sorry, I'm jumping all over the place on you. What's a specific qualifying criteria for a child to receive a non-financial based waiver? Is it all a diagnosis?
Financial eligibility is always in a requirement.
Okay, so
unless I don't understand your question.
I'll just reread it. Are there specific qualifying criteria for children to receive non-financial based waiver?
No, the waiver programs have a financial piece and a medical piece.
Okay. In regards to, let's see, one thing I think has been pointed out to me from some of the therapists I've dealt with. They said that Alabama does not allow kids with autism to apply for Medicaid as a secondary insurance. Why is that? And is there a plan in place to make an adjustment to that?
The diagnosis is not the issue. I mean, you have to qualify for Medicaid, either basic Medicaid, or you have to qualify for Medicaid through a waiver. So it has nothing to do with the individual's diagnosis. If they can meet the criteria for one of our waiver programs, then they can be eligible for that program.
Okay. Do you happen to know, so there's a limit currently on reimbursement rate for gate trainers. The current reimbursement rate is well below what actual DME vendors are providing. Is that something that might ever increase? Is that something even that's a federal requirement, or is that a state level decision on if that limit will ever increase?
Those rates are in our state plan at 80% of the 2005 Medicare rates. It would take a state plan amendment to change, and we have not received feedback that it was insufficient. So if that's what providers are saying, that feedback has not gotten to us. So we're open to that feedback.
So we haven't had, we're basing rates off of 2005 rates, not current day.
Okay. Correct. That's what the current state plan says.
Okay, that's interesting. Let's see. All right, I got one about diapers. Diaper coverage is for non-ambulatory children, but what about those who have neurological bladder and bowel that cannot control themselves, or children with profound intellectual disabilities? Is there a way for them to receive diaper coverage?
Let's see. I reached out to our DME expert for this. If there is documentation showing that the individual, due to their mental status or cognitive or developmental disability, is unable to assist in their toileting needs, documentation of the extraordinary need can be submitted and evaluated.
Okay.
And the details related to that can be found on our website.
I gotcha. In regards to bath equipment, why is bath equipment not covered for children who cannot sit or stand?
The equipment is not listed as bath equipment specifically in DME, so without a procedure code, I'm unable to address that specifically. However, any need of a child can be evaluated by the medical director.
Okay. I'm sorry, I'm trying to look at the questions that we're getting on Facebook. Nope, nothing there yet. Let's see. The wheelchair requirements. I get a lot of requests for wheelchairs, and a lot of times some of the parents tell me, hey, I was given a used wheelchair, or I've had this one for 5 and 6 years and I haven't been able to upgrade yet. Is there a plan in place, or have there been discussions about changing the limit to how often a child can receive a new chair? I think currently we're at 5 years. Yeah, it's current eligibility is 5 years, and then children have a 3-year window. For children, I mean, I can specifically speak on my daughter's behalf. I believe she's on her 3rd different chair. We got one when she was about 18 months. We got one when she was 3. And then, well, 3 or 4, and now we've got another one that we've just received recently. But we have private insurance, and then we've also paid out of pocket. For Medicaid, that's not the way it works. You're only getting one chair every 5 years. Is there a plan in place to change that? Is that an option that parents can apply for a change to, or is that just a conversation
there's an opportunity to have an evaluation done if it comes through with an EPSDT request. That can be reviewed on an individual basis. If the child has outgrown the chair, it's broken, it doesn't work, those are opportunities that we can individually evaluate that case.
Okay. So I have another question about, let's see, a day program. This comment says, I very much want my child with involved medical care to have access to socialization at a day program instead of being at home with a caregiver. What will my options be now that the community waiver program is the only option in 11 counties in our state?
Sure. So the purpose of the community waiver program is, to offer services in the community-based environment based on an individual's needs. And since that program has gone live, we've found, individuals are more satisfied with opportunities in the community in general during the day. So that's what we found, and that is the option in those 11 counties.
Okay. Diaper coverage, bath equipment, gate trainers. I guess we really have covered a lot. Quick think that honestly, I can't come up with anything. I'm sorry. So you said, did we get an answer on the percentage of Alabamians that have Medicaid?
2019 says 26% of the population.
Okay. So if we were to expand Medicaid, what do you anticipate that number might be? Would we go up to 30? Would we go up to 40? Just too much to guess?
Too much to guess. I would hate to throw a number out there. That's a lot depending on, what the income requirements would be, and then updated information from 2022, it would be hard to predict.
I gotcha. One thing that I am kind of curious about. So my daughter has spastic CP. She's wheelchair bound. She'll never be able to walk, talk, hold her head up. She'll never be able to do anything for herself. When we applied to Medicaid and to Social Security, it was 2014. We were denied quickly. Now we did have some professionals that were like, hey, you can apply through the waiver, but we never went forward with it because we were told that the house and the income in the house was too much. Based on what I've told you with her medical care, could we attempt to apply through the financial waiver or the non-financial waiver, I guess, because her care is so great? Would we still be able to apply, and should we apply?
I want to clarify, when you apply for the waiver, the income and resources are evaluated on the individual. So it would be your daughter only. Wouldn't be you, wouldn't be your house, wouldn't be your income. It looks at her as an individual. So you absolutely could apply for the waiver. Okay.
Now, if she does have a decent amount of income, because of her situation, is there a way? I assume she would not qualify because she does have her own medical trust set up. Is that correct, or is there a way that because her medical need is so great, she still could qualify?
It just depends on how much income we're talking about and how the trust is set up.
Okay. So that's fine. That definitely covers that question. One other item I know specifically that is almost always denied in regards to some of the families that I help is these cranial forming helmets, specifically for plagiocephaly. I've probably helped on probably 10 to 15 different families with these helmets, and they're quite costly. And they always come to me and say, Medicaid says they're not covered. Medicaid says I have to jump through this hoop, jump through that hoop. And it always seems like the hoops are in a way designed to let the time frame be so long that then the guidelines state, hey, after 1 year, we don't have to pay for it. Is there any truth to that? Is that just a guideline set up by the state or by the federal government, or is it on an individual basis?
Well, I hate that's generalities that you're speaking of. I can address individual cases, but no, there's no policy. We will evaluate each individual. The physician can review that. Our medical director can review that. So I'm sorry if that's what some people have experienced, but there's not a policy to wait on something, if that's what I gather what you said.
Yeah, multiple parents have just expressed a concern with the time frame that it takes, I guess, the decision to be made on the helmets, and that I think the rule is that after 1 year, the rule says they don't have to, it's not paid for after 1 year. And they felt like it's kind of been a slow answer that doesn't come in. And it's like, hey, you got to do therapy for 6 weeks or 6 months. And so that's the big item that I get a lot of feedback on. And I know I've talked to some physical therapists that have said, yeah, absolutely. The therapy can help, but more often than not, they need the helmets, and they're just so expensive. And more often than not, these families cannot afford them. And they well, I have a pediatrician who will write me a note, but it just doesn't seem to help. And what can I tell these parents? How can I tell them to continue to fight to get the item covered?
Each individual is evaluated differently. I would encourage you have my contact information. You can send that. I can't speak, of everybody at the same time. You're saying this is what you're experiencing. I would be glad to address any individual parent that wants to talk or has had a concern, and help walk that through the process it needs to go through.
Okay. Trying to think if I've got anything else. So you've been with Medicaid, you said 16, 17 years now.
Yes.
What are some of your most the biggest changes you've seen take place?
From like I said, I was 15 years in waivers. It's great to see the federal government pushing towards community living and being supportive of that and spending the dollars in community living. We have several initiatives about moving individuals from the institution to the community, from the hospital to the community, so they don't ever, have to, have the admission at the nursing home if it's not necessary. We can get them out and transition them out from the hospital. So just great initiatives like that promote community living.
I definitely agree with that. Well, I have asked just about every question that I have been presented with, and that is all I can come up with. I really appreciate you talking with us and answering our questions. And hold on, I just got a text.
Well, I wanted to mention something. You had 2 questions saying anything else that I could suggest. The public health emergency is currently active. At some point that will end. and that may or may not impact some of the individuals that, the Medicaid recipients that you're familiar with. So Melanie in our communications office can give a briefing about how the state has to go about redetermining all those individuals when the public health emergency is eventually over.
Okay.
I'm all just on this.
Sure. Go ahead.
Yeah. Good afternoon. I'm Melanie Cleveland. I'm Communication Director with the agency, and I do appreciate this opportunity that you guys have given us to hear a little bit of feedback from you and to hear from the expert, our Deputy Commissioner, Ginger Weddingfeld. So, but what I wanted to convey is those of you that are Medicaid recipients, you've kept your coverage throughout the pandemic. That is actually a federal guideline that we have an increased amount of federal funds. The FMAP is what they call that, or federal matching. We have increased funding from the federal government in order to keep all of our existing Medicaid recipients who either became eligible or were eligible since March of 2020. And so they have not had to necessarily fill out paperwork and reapply for coverage. They've kept that coverage since March of 2020 if they've been on the roll. So what's really important for our Medicaid recipients to pay attention to is this will come to an end at one time. Right now, the end date is July. We expect it to be extended to October. And then there is the potential that the public health emergency could be declared to extend even past that. But right now, we're expecting October of 2022. And what that means is everyone who has not sent in renewal paperwork or reapplied for a Medicaid program, if they're not automatically renewed, they'll need to send in that information and make sure that Medicaid has their current address, phone number, email addresses, family size, whether they've had a baby. They need to add that on there. So, all of that information is so important that it's up to date right now with the agency so that when that public health emergency ends, we can contact those people and send them something in the mail and they'll actually receive it. There's a good number of our recipients who have not kept that information up to date, and so we may not have an up-to-date or accurate address. So right now, the big push that communications is putting out, not just through Medicaid agency, but through all of our sister agencies too, through Rehab Services, Department of Mental Health, Alabama Department of Public Health, all of these other sister agencies who work closely with our Medicaid recipients are putting the same message out there to update your address and make sure that it stays up to date so that when we get ready to send these renewal notices and letters and notices to recipients, they get the information they need. So we just wanted to take that opportunity today to put this out to you and to everyone on the Facebook Live today, that they just understand how important it is. Such a simple message, but it is so important that the agency keeps up-to-date information on you.
Okay.
Thank you.
Well, I appreciate you telling us that, because you're right. That is something that I bet gets kind of lost in everything that's going on. So thank you for telling us that, and hopefully that word will get out. I actually have gotten a few more questions that I would like to ask Ms. Weddingfeld, if you don't mind.
Sure.
So with your new role as the Deputy Commissioner, can you kind of tell us a little bit about your goals that you have for the next, say, 6 months, year, kind of what you have planned and what you hope to see accomplished?
Well, that's a lot. Just the opportunity to provide the services to the individuals that need them in the best location that they can receive them. Do the best we can to modernize and modify our programs to meet the current need. So I definitely moving forward, CMS has been very forward thinking in some of their, changes they've made to programs, and that's great news. Giving us more opportunity to be creative and how we can best serve everybody. So I'm absolutely looking forward to that.
Okay. And then, so one thing that I've been told and have dealt with a little bit is a little bit of a lack of transparency in the Medicaid system. Is there a way, I guess one of the big questions is how, this specific question says, how does the Director of Communications for Medicaid interact directly with recipients and families to let them know about policies, procedures, and changes affecting their loved ones' care and Medicaid eligibility? So yeah, come on back.
Okay, we'll do our musical chairs here. Yeah, I'm so glad you asked that question, because I have been in this position a little over 3 years, and in this time we've tried to open up avenues to ways to communicate directly with recipients and with all of our target populations. The best way a recipient can stay in the know is to make sure that information is up to date, so when those notices are put in the mail, they actually get to their mailboxes. But second of all, we have a lot of electronic means to communicate. And one of those, we have a texting service or a text notification. You can sign up for that, and I'll have to make sure, I believe it's the number that you text to is 888-777, and you use a keyword Medicaid AL. And if they type in Medicaid AL to 888-777, that puts them on a recipient text message list. And that way, if there's something big, something important that they need to know about, we're sending those messages out by text message to those recipients. Now, another way is just to go to the website, medicaid.alabama.gov. And I know there's a lot of information on that website. You can get overwhelmed real quick if you're trying to look for something. I do realize that. But one way is just goes directly to a recipient tab. When you log on to medicaid.alabama.gov, you look on the very top of that page and you see a line of tabs. And there's one that says Recipients. If you click on that recipient tab, there's several areas underneath there that I have really made an effort to outline things in a simple way with simple language. We take plain language requirements from the federal government and we adopt those into what we're putting out for our own recipients. And we try to make sure that most vital information that recipients need to know is put out there under that recipient tab.
Okay. I love the texting idea. I feel like there's so much information that people probably overlook in email, and sometimes they get lost in snail mail also. So I'm glad to hear there's a texting option. I did get a question that says, how are families notified of the Medicaid texting service? Are those general Medicaid or waiver specific information?
Sure, those are for general Medicaid recipient audiences, so it would be all recipients across the board. And it's very limited, the number of characters that I can put in that text message. So typically what you'll see is information like recipients update your address, and then I'll put a web link and it'll redirect them to our website. That'll have all the detailed information they need to know. Now I neglected to mention our Facebook page. Alabama Medicaid has a Facebook page, so we're on Facebook now, and it makes sense. If you like our Alabama Medicaid website, Facebook page, then you can go on there and you can see time to time. For instance, if a district office is closed due to inclement weather, we could save you a trip to that DO office if we've got a bad storm coming, or if the roads are icy, things like that.
Okay. That's a great idea as well. I know social media and texting, I feel like that's where most people get their news and information these days. So that's awesome. Thank you for sharing that.
And I'll mention one more thing, Lane, if you've got a few minutes. Sure. We do have a inquiry section where you can actually email us. That's manned by my staff in communications. And if you go to medicaid.alabama.gov and you go to the Contact Us section and you fill out an inquiry form, you usually get a response same day by email. Okay. So if there's ever anything someone's wondering about, they can go to the FAQ section, the frequently asked questions, and that's also under the Recipients tab. If you can't find the information you're looking for under the FAQs, go ahead and send us an email on that inquiry section on Contact Us tab. and we'll be happy to get you to the right person. You know, you asked a lot of questions about what do you do if there's equipment that's not covered and you want to know what to do about it. Send an inquiry through that contact us section, and we'll go ahead and forward that message to the correct person, the program area that can help assist you.
Okay, that's wonderful. Thank you again for covering all of that. Miss Weddingfield, I did get, Miss Paige Perry is putting some really good questions in here, and I wanted to try to ask at least one or two more of these if you don't mind. She says, paratransit services in both urban and rural settings is a large barrier to improved quality of life for Alabamians with disabilities. How is Medicaid working to make safe, reliable transportation for people with disabilities more readily available?
We do have, the non-emergency transportation available as a service, but we also, have the opportunity to pay individuals if they make their own trip. If you have an issue in a specific area, please email me. Please use the inquiry form. We can address any pockets of areas, that appear to be having a barrier to transition or transportation and getting to the physician or wherever it is they need to go. I can address absolutely any specific situation.
Okay, awesome. Thank you. And then let's see. I'm gonna close with this one. Why does Medicaid coverage of preventative dental care end at 18 years old for Alabamians with disabilities?
That is current state policy, that we cover the dental for the children, and it would take a state plan amendment to change that. If that desire's there, we can entertain that, but that's just the current policy that we have in the state right now.
So in order to make a policy change, would you recommend someone, a parent, to reach out to a politician, or how would you recommend that?
I mean, we get inquiries all the time about people, asking about coverage. We can start there, and somebody can address it. Somebody in that particular program area can, provide, information about if it's on the radar or when, or, what would have to happen for that. We need funding for that to happen. So it's not currently budgeted. So we would need a funding source for that.
Right. Okay, well, that is where we will conclude everything that we've asked. I really appreciate both of you for speaking with us today and for answering our questions. And I hope that we continue the conversation, whether it be 6 months, a year. I hope that we can come back to the table and, take the conversation a little bit further. And I thank you both for your work and for all the hard work you're doing for Alabama, for the Medicaid system, and for all of the recipients. So thank you both, and y'all have a great afternoon and a great evening.
Thank you.
Thank
you
you
too.
You too. Bye-bye.